Cases of West Nile virus are on the rise all across the country. At least 13 cases were reported in humans as of last week. Iowa announced its first case on Friday, joining 9 other states with reported cases. So far, Wisconsin is not one of them. Joining us to talk about this and our other health headlines, Dr. Jeff Pothof, UW Health Chief Quality Officer. Doctor, great to see you. So Iowa and Illinois, they have had West Nile cases now confirmed. We're no stranger to it. We don't have any cases right now. Is it only a matter of time before we see some cases here in Wisconsin this season?
Yeah, Ben, I think it is probably just a matter of time. We typically start to see our first cases of West Nile disease in June. Our cases will peak usually sometime August, September, but about that time of year where, unfortunately, a few unlucky individuals will come down with this disease.
Yeah, thought it was interesting reading about West Nile. It reminded me of some of the early talking points with COVID. A lot of people who get West Nile won't even know they have it, right?
That's true. Only about 1 in 5 people who actually is infected with West Nile will have any symptoms. Only about 1 in 150 will have severe symptoms. And for those that develop symptoms, sometimes they're going to be just like any other typically viral illness, headache, fever, muscle aches. So a lot of folks who have West Nile probably never knew that they had it.
Right. But if it starts to really, when should you go see your doctor about it?
Yeah, I think, certainly if you're having, fevers, they're uncontrollable. And for West Nile, where it gets dangerous is when you have neurocognitive decline. So you start to get confused, you have altered mental status. Those individuals typically have a more severe case, a worse prognosis. A good idea to talk to your doctor, or if it's really bad, seek care in an emergency department if you're very altered.
About 1 in 150 people have to get that extra treatment. Hey, a new study says liver disease is soaring, specifically non-alcoholic fatty liver disease. What's going on?
I think this is a bit underappreciated. I think, when we talk about being overweight or having diabetes, high cholesterol, a lot of us go right to heart disease, stroke, and things like that. But it actually causes your liver to also kind of get full of fat cells, which over time can lead to cirrhosis and liver failure, which, not reversible if it's cirrhosis, needs a transplant. Just another reason or another, good reason for why folks should be careful about their diet, making sure that they're exercising, eating a good diet, so they don't suffer from liver disease on top of stroke and heart attack.
My mom said eat veggies, but I didn't know she was talking about non-alcoholic, fatty liver disease. But that's a good reason to eat your vegetables as well, to keep that away. Hey, let's talk aspirin real quick. There's a new study about aspirin use. There was a time where the doctors used to say take an aspirin a day, keep the heart attack away. That's no longer the recommendation, right?
It's not, and you're absolutely right. So, years ago, unless there was a strong contraindication, most individuals 65 and older were told to go on a low-dose aspirin a day. And what we've known now, since more people have done research, is that might not be the best advice. There's individuals who are going to have higher risk for complications of aspirin therapy. And what this study shows is that folks who are on a daily aspirin have a slightly increased risk of anemia, likely from a small amount of bleeding that goes into the GI system. So it's not that aspirin shouldn't be taken by anyone. Folks who have previous history of heart disease, stroke, certainly talk to your doctor. There is a use for aspirin, but the idea that we just take aspirin because we're getting older, that's kind of old news.
Yeah, that's a good thing maybe to bring up with your doctor. If you are someone who takes aspirin a lot, another thing to talk to your doctor about. We're happy to talk to you on Tuesdays, Dr. Pothof. Appreciate your time.
Thanks. Have a good day.